Are you wondering if some of your symptoms might be related to vitamin D deficiency? Looking to find out what are the common vitamin D deficiency symptoms? My name is Dr. Taranella, and in this video, we're going to look at what some of those common symptoms are. How do you know if you have enough vitamin D? Who is susceptible for vitamin D deficiency? And other questions surrounding vitamin D3 deficiency. So if you like this kind of information on vitamin deficiencies, nutrition, and hormone-related topics, click on the like button and don't forget to subscribe to the video to get more videos like this one. Now for a quick disclaimer. The information contained in this video is for informational purposes only. It is not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deepen your understanding of health and treatment success. If you need medical attention, don't delay in seeking that treatment. Okay, let's look at what are the common vitamin D deficiency symptoms. So we want to look at what are common vitamin D deficiency symptoms. But I should point out that the symptoms of vitamin D deficiency are not necessarily unique to vitamin D itself, meaning that those symptoms can be also attributed to other health problems, conditions, etc. So the symptoms alone are not sensitive or specific enough to know if you have a vitamin D deficiency. That being said, you can use symptoms as kind of a general guide to understand what the likelihood of being deficient might be. There are other ways or indicators that may suggest vitamin D deficiency as well, too, such as where you live. Vitamin D deficiency is more common as you get further away from the equator, and also depending on what the weather is like there. If you have more sunny days, you're less likely to be deficient in vitamin D. And that just has to do with the angle of the sun and how much vitamin D you're going to produce when the sun hits your skin. The more sun, the more directly over the top of you, the more vitamin D you're going to produce at any given time when you're outside. That being said, if you don't spend a lot of time outside, you're probably not going to make a lot of vitamin D either. Or if you put sunscreen on when you go outside, things like this, you're less likely to produce vitamin D. Whereas if you're someone that works outside all the time, you're more likely to have sufficient vitamin D. There's more things that go into it as well, and we'll talk about that in just a second. But first, what are common vitamin D deficiency symptoms? Some of the common vitamin D deficiency symptoms include things like bone pain, arthralgias, which is like joint-related pain, myalgias, which is more muscle-related pain, fatigue, muscle twitching, also known as fasciculations, also weakness, low back pain, proximal muscle weakness, so like upper thighs, for instance, throbbing bone pain, which is also bone pain, but specific to the sternum or even the tibia when you're pressing on it. So the lower leg is the tibia. So those are some of the common reported symptoms in research papers that I looked up. But in my practice, what I commonly see when people take vitamin D is it improves their energy levels and does provide some additional support to immune system. So if you're someone that gets sick a lot, you may be vitamin D deficient too. If if some of these other things are also lining up, such as where you live, how much sun exposure you get, if you do have bone pain and things like that, vitamin D might be something to look into in terms of getting your levels checked. Now, there's also a lot of associated health conditions with vitamin D. So I wouldn't say these are symptoms per se, but they're kind of things to make you think twice if you do have these. So things like diabetes, cardiovascular disease, being obese, and then there's lots of cancers too that are associated with vitamin D deficiency, like ovarian cancer, breast cancer, prostate cancer. So if you have any of these conditions, it's more likely that you have deficiency, but it's not that these conditions are causing it. So now more than likely, you're going to go out and get tested if you think that you might be deficient. So we want to look at what constitutes deficiency to begin with. So when you're doing this test, it's usually you want to look at the 25-hydroxy vitamin D3. And there's different ways to look for this. The mass spec liquid chromatography is always going to be the better test to do. But the other test that uses more immunoassay is also very sensitive and serves as a useful guide to see where, generally where your vitamin D levels are at. So vitamin D deficiency is constituted as anything less than 20 nanograms per ml. Some labs will even market anything less than 30 nanograms per ml. But really what you want to look at is, do you have optimal levels of vitamin D3? And for optimal levels, there's a lot of debate about what constitutes optimal levels. And perhaps it's going to matter too, based on your genetics, if there's changes in your vitamin D receptor, for instance. But I like to see the 25 hydroxy vitamin D3 around 45 to 50 nanograms per ml. Could be a little bit more, could be a little bit less. Too much, I think you're running into the risk of high calcium and the problems that may be associated with that. But certainly anything above 80 would be considered, much more risky. And then anything less than 20, you're probably going to run into problems long-term with immune problems, bone problems, osteoporosis, things like that. There are some genetic things that do play a role in your vitamin D. So when you're looking at your vitamin D status, understanding your genetics, for instance, genetic alteration and the VDR SNP, single nucleotide polymorphism, can increase the need for vitamin D overall. And then there's also some genetic alterations that might change how efficient your body is at making vitamin D. So those are all things to consider when you're looking at your actual numbers to see if you need more vitamin D in your body, etc. But if your levels look good and you're still having these symptoms, probably need to look elsewhere for what's causing them. Now, in terms of getting adequate vitamin D deficiency or to prevent vitamin D deficiency, you should spend 15 to 20 minutes in direct sunlight every day with about 40% or almost half of your body exposed. If you have higher concentrations of melanin, so you have darker skin, it's going to reduce the amount of vitamin D that you produce when you're out in the sun. Similarly, as you get older, and sometimes if you're overweight, they think that that may reduce the amount of vitamin D that's being produced by sun exposure. Using sunblock, as well as, if you have windows, tinted windows or otherwise, it's going to block that UV radiation as well. As we mentioned, sunblock. And if you're, not working outside, living in more northern climates, you're also at risk for vitamin D deficiency. So that's about all I had to say about this question. What are common vitamin D deficiency symptoms? Some of the information I did gather from this research article, which I'll put a link to in the description, goes into a lot of details on what some of the symptoms are, how common vitamin D deficiency is, and the difference between sufficient and insufficient levels, adequate levels, etc. So you can check that out if you want to. All right, that should give you a better understanding of what are the common vitamin D deficiency symptoms. If you do have any questions about the contents of this video, just drop the question in the comment section. I'll definitely try and answer your question. I may do a separate video on that topic. Lots of stuff around vitamin D if you're interested. So thank you again for watching. We'll see you next time.